Good afternoon, everyone. I hope you're all enjoying this beautiful spring day. Thank you for joining our office hours that are exclusively for the adult day centers in Virginia. This is our fifth office hour session in the series. My name is Emily Varville. I am the project manager at Leading Age Virginia. Leading Age Virginia is an association of not-for-profit aging services organizations serving adult day centers, senior housing, assisted living, nursing homes, and home and community-based services. We have covered the following topics so far in previous sessions. We did a session on information about the grant and the model policies, the IPC needs assessment results, workplace learning principles, and the last session was on participant care equipment, devices, and supplies. If you missed any of the previous sessions, the recordings can be found on our webpage. We will place the direct link for those recordings in the chat now. I am going to get started with a few housekeeping notes before moving on to our content for today. If you would like to ask a question, please use the chat option at the bottom of your screen. You may raise your hand if you would like to verbally ask a question, and all links will be placed in the chat as needed. All office hour sessions will be recorded, and you will have access to those recordings after each session. Most office hour sessions will be set up in a similar format, consisting of a short presentation and an opportunity for Q&A at the end. We invite guest speakers to come and give educational presentations about a variety of infection prevention and control topics to ensure that each center can learn about current infection control practices that are applicable to your center. So the main content for today's session will be a presentation by Amanda Holliday from Virginia Department of Social Services. Her presentation is on hand hygiene, respiratory hygiene, and cough etiquette. Amanda Holliday is a seasoned registered nurse with 25 years of healthcare experience. She possesses a remarkable skill set that centers around the unique needs of the geriatric population. Her extensive background spans various healthcare settings, including pharmacy, hospitals, rehab centers, home health, hospice, and public health. Amanda's deep understanding of healthcare in the 21st century is both comprehensive and powerful. She currently serves as an infection preventionist for the Virginia Department of Social Services, covering the Eastern Peninsula, Northern, and Northwest regions of the state. Please help me by welcoming Amanda Holliday to our meeting, and you can begin whenever you're ready, Amanda.
Okay. Well, welcome everyone today. We are going to discuss 3 essential practices to keep our adult day participants healthy: hand hygiene, respiratory hygiene, and cough etiquette. Don't worry, I'm not going to bore you to death. I know y'all have been over this a million times because we already understand the importance of these practices. But what we're going to do is learn some ways to encourage your participants to follow them so we can create a safer and healthier environment for everyone. Next slide. So our hands encounter germs throughout the day. These germs can then be transferred to our faces and to others, leading to illness. Proper hand hygiene helps to remove and kill germs on our hands, preventing them from spreading. And if we can do that, we could save 1 million lives every year. Next slide. So here we have some key moments when hand hygiene is essential. By reminding and encouraging your participants to perform hand hygiene at these times, you can significantly reduce the spread of germs. Some of these moments are obvious, but a few others might come as a surprise to your participants. Upon arrival and after coming inside from outdoors or an outing is really important because you have no idea what they touched prior to walking into your center. The same applies to pets. You don't know what those visiting therapy animals that everybody loves get into when they're outside. I mean, if any of you have pets, you know what your dogs and cats do when they go outside. And then they come in and everybody wants to pet them. Also, when somebody smokes, tobacco residue remains on the smoker's hands, and this residue actually contains toxic agents that can be transferred to people and surfaces. So, while those 3 may not be obvious to your participants, that's why it's really important that they need to wash their hands in those situations as well. Next slide. So let's make it routine and fun. I know routine's not usually fun, unless you're me. I love routine. But let's make it part of the daily schedule because that stimulates muscle memory And you will find that some participants may start to perform the action on their own just by you incorporating it into your daily schedule. And also, learning is more engaging when it's fun, and that spans all ages, all demographics. So try incorporating visual aids and interactive elements to make hand hygiene education more enjoyable for your participants. For example, you could try a glow germ activity like you've done with your staff. You can do it with your participants. You can put it on their hands and do the whole hand washing activity with them, and let them see, you did a great job, except for you missed like your fingernail. It will really pique their interest, and it'll be fun. If you haven't received a glow germ kit, please drop your name and email address in the chat, or later at the end, Emily's going to share my email address. Just let me know if you don't have a glow germ kit in your center, and we will get one to you. You could also try adding scheduled education times to your calendar for your participants. Show a CDC or VDH video, or you could give your own presentation. And then at the end of this video or your presentation, give them a quiz and hand out prizes. You could also watch one of their favorite movies and ask them to be IPC critics and point out key moments where hand hygiene should have occurred. Next slide. So coughs and sneezes are common. We all do it. But they can easily spread germs. So practicing good respiratory hygiene and cough etiquette can significantly reduce the risk of spreading illness. Next slide. Oh, yeah, you're right. These are two key moments for respiratory hygiene and cough etiquette. Coughing and sneezing, as I just said, does spread germs through the air. And by offering and encouraging participants to wear a mask, use tissues, or the bend of their elbow, you can reduce the spread of those germs. Next slide. All right. Does anybody see what I've done here? I'm attempting to stimulate your muscle memory by duplicating this slide. The message is the same with some modifications for respiratory hygiene and cough etiquette. So you're either going to remember this because it bothers you that I duplicated the slide, because it bothers me, or because I just stimulated your muscle memory. Either way, you're going to remember the message. You can use the previous activity examples that I gave for hand hygiene. You can use the same ones for respiratory hygiene and cough etiquette. But another thing I want you guys to consider when you're thinking about how to engage your participants in the hygiene practices, hand hygiene, cough, and respiratory etiquette, is their demographics. What culture, what is culturally, what does this mean to them? Let's look at, their age. I suspect that many members of, the centers are probably from the greatest generation or the silent generation. These two specifically, when you're discussing why this is important, you want to keep it direct and clear, use visuals, everyday words instead of medical terminology that we're used to using with each other at work, and then make sure you focus on the benefit. Also, try connecting with their lived experiences. Remind them of how public health measures like hand washing helped conquer diseases like polio and typhoid fever. They will remember that, I promise you. And also how it played a role during war times, keeping soldiers and communities healthy. Lastly, highlight how their adherence to these hygiene practices protects not only them, but their family, and thank them for understanding the importance of personal hygiene and community health. With all of your members, I'm sure their families are really important to them. So that's definitely going to strike a chord, and also thanking them because, they play a role in this, not just, us healthcare workers, but your participants play a role in keeping everybody safe, and thanking them for that is going to make a huge difference in how they receive the information that you're trying to give them. Next slide. So you and your participants together, you guys are like superheroes fighting the germs in your building. Together, you can keep them away. So try to think of at least one idea or activity that you could implement at your center, and while Emily, does the rest of the presentation, think about that and drop it in the chat or save it at the end of the webinar. And that's it for me. I know it wasn't very long, but we can beat a dead horse with hand hygiene and respiratory etiquette and cough etiquette. That's not what we're here to do. We're here to help you guys figure out how to get your participants on board with it. So share your ideas with me, share your ideas with each other. I have listed, if you can go back one slide, Emily, I'm sorry. There you go. I've listed some resources for you all. CDC and VDH have some really great posters that you can download and print out. They also have amazing little short videos on their YouTube channels that I've listed. That some of them I like because they have that gross out factor, which will make people remember it because they're like, oh, that was disgusting. And then some of them are just funny. So don't forget to check those out. And then that's it for me, Emily. Thank you.
Thank you so much for your presentation. And like she said, if anyone has any follow-up questions for Amanda, we will share her contact information in the chat. And she will also be on for the rest of today's session to answer questions during the Q&A section of this meeting. So now I have a couple polling questions that I'm going to launch. While you complete the 2 polling questions, Betsy will drop the link to the template policies in the chat. You can find both the respiratory hygiene and the hand hygiene policies on this webpage that she's going to share the link for. And while you guys complete the poll, I'm going to move on to our next exciting thing is that we have a new resource. So some adult days have mentioned needing additional resources and support for cleaning equipment that travels back and forth between the adult day center and the participant's home. We worked with HQI to develop a one-pager about cleaning, sanitizing, and disinfecting personal equipment. And we will send an email with this resource attached and get it added to our webpage as soon as we can. It's a new resource, so we're still getting it promoted, but you guys will have access to it. All right, and the next. So we have more IPC resources coming soon. We received feedback from centers about wanting more uniform guidance about COVID protocol within adult day centers. So we are currently working on COVID-specific guidelines for adult days. We are also developing infection control one-pagers that can be given to participants, family members, and caretakers to provide IPC education in the at-home setting. The one-pagers will be on a variety of infection control topics and will break them down into plain language, making infection control recommendations easy to follow. Due to the unique circumstances of adult days that participants live at home and come into the center, following the proper infection control precautions at home will lead to keeping participants and center staff safe. Both resources are in the development phase, and I will share more information about them during our April office hours session. So this is just a list of some quick reminders to complete the IPC needs assessment, visit our webpage, request technical assistance from me or HQI, also register for the office hours series, and I will be starting center visits in April. So this is some information about the next office hour session on April 10th. Betsy will drop the registration link in the chat. By registering for today's session, you should already be registered for the next sessions, but feel free to use this link and share it with colleagues that may also benefit by attending these office hours sessions. And this page includes my contact information because I am your main point of contact for everything related to this project. Betsy will drop my email address in the chat so that you have it. And now I will be stopping the recording so that you feel comfortable sharing with our team during the Q&A section of this meeting.